For those of you who do not know me, maybe this is your first time jumping on, maybe a kind woman tagged you because we're going to be talking about men's health today. My name is Amie Hornaman, and I am a functional medicine practitioner specializing in the thyroid and hormone conditions. So that's why we are digging in today to talk about men's health, because we hate leaving you guys out. So where to start with you guys? Let's talk about the thyroid, and then let's connect it to testosterone and all the hormones. So this is going to be a game changer for you, and you can probably hear the excitement in my voice. The latest introduction, the latest member of the family to the Fixxr line is Metabolism Fixxr. And this, oh my God, I formulated this just for all my people out there that need to lose weight, that need help in the weight loss department, that can't lose weight no matter what they do, that feel like they have a slow metabolism, and that might be thinking of trying all those peptides out there, you know, the Beverly Hills soccer mom drug of choice for weight loss peptides. Or even if you're on them already and you're like, man, these are really expensive and I'm still not losing weight, add in Metabolism Fixxr. Here's what I did. I took the power of T2, which increases your basal metabolic rate while you are sitting there watching Netflix. You're burning fat while you're watching Netflix. I combined it with a very unique patented ingredient called Suppressa. Suppressa has multiple clinical trials backing its efficacy in reducing your appetite, decreasing snacking, and providing way more control over your food intake. It is amazing. We also see improved emotional well-being, just decreased food cravings all around, reduced hunger, and weight management. Add on top of that, we have green tea extract, we have purple forest purple tea extract, both of which affect the metabolism in a very positive way without the jitters of normal fat burning supplements out there from the 1980s and 90s, right? The ones that made you feel like you're having a heart attack. You will not have that in any of my supplements, Thyroid Fixxr or Metabolism Fixxr. But Metabolism Fixxr, ooh, yeah, we kicked it up a notch. It is in powder form, so you can drink it through your day. It's going to flavor your water. We got orange crush and refreshing citrus. I love them both. It is going to keep you under control all day long. So you throw a couple scoops in your water bottle in the morning, throw a scoop or two in your water bottle throughout the day. You will have fat burning and appetite control the entire day for what? An eighth of a price of the peptides? Oh my God, you can't go wrong. So grab some Metabolism Fixxr today. Please let me know how you do on it. I am super excited for you. Super excited. You know what? No, let's start with your symptoms. Okay, so if you are a guy and you feel lethargic and you've gained a lot of weight and you just kind of feel depressed and low energy, you are unmotivated to work out, maybe you've lost some muscle in addition to the weight gain, maybe you're struggling losing weight, it could be your thyroid, it could be your testosterone levels. So recently, I've seen so many men as patients come to me over the last few months to a year with low testosterone. And we're going to be talking about the optimal lab value ranges as well. So hang in there. And if you have any of those symptoms that I just mentioned, it's definitely worth staying tuned, because when we talk about the optimal range, you know, I always talk about optimal and not just normal. When we talk about the optimal range, it's going to get interesting because that range is wide and vast and it's too big. So, you know, when we talk about hitting the side of a barn, I've given you the analogy before. Functional medicine looks at optimal, not just normal. Normal lab value range is if you stood back there and I gave you a ball and I said, hit this side of a barn, you could hit it. That's what testosterone levels are. They're like this. Of course, you're going to hit the side of a barn. But if I put a target on the barn and then I say you got to hit that target to be optimal, you may or may not. Don't know. Testosterone levels for men are a very narrow target, and they're nowhere near where normal begins in the standard lab value range. So you might have been told that everything is normal, but I want you to stay tuned. Grab your labs. If you know your testosterone levels, grab them, pull them out. Okay, so tired, depressed, low libido, fat gain, weight gain, inability to build muscle, don't even want to go to the gym. Maybe you've lost some muscle. On and on and on, hair loss, we could go on. But a lot of these symptoms can be confused with thyroid symptoms. When we are looking at men's health, we have to look at the thyroid, make sure that that's optimized, but we also have to look at testosterone and estrogen levels. And of course, we pull in insulin levels too. We have to look at you from that whole person perspective, right? Looking at your symptoms, what you're dealing with, and then looking at all of your labs, just like I do every patient, looking at all of your labs from optimal and not just normal. So with thyroid, you can, if you want to see what labs you need, you can go to my website, amiehornaman.com, and click on the free guides. So in there, you can download the lab and symptom checklist, and you'll have all of the labs to get for your thyroid, as well as the optimal lab values. And that's very important for guys for you to start with before we start getting into the hormones and how everything affects everything else. And let me just say, low testosterone is not just about feeling better. It's not just about having a good libido. It's also imperative to your health. And this is where some doctors drop the ball and tell guys that they're normal when they're in that lower part of the range. Low testosterone is tied to an increased risk of cardiovascular disease. So if you have heart disease, CVD in your family, and you are worried about your own heart health, do not have a low testosterone, because that's going to put you at a greater risk. You really want your testosterone levels to be optimal and not just normal, optimal. And then in addition to the low testosterone causing an increased risk of cardiovascular disease, it's also going to start affecting your weight. So as weight goes up, then insulin resistance occurs, and insulin resistance is tied right back into testosterone, estrogen levels. I'll show you in a second. So it's kind of a vicious cycle. If you've been told that you have bad lipid panels, high cholesterol, and you've been put on a statin, it's very important to realize that statin medications can lower your testosterone levels, and that low T could have been the initial cause of having high cholesterol in the first place. So as I said earlier, if you are a woman and you're listening, take this home to your man, because you know guys wait until their health is in the basement before they do anything about it. So you ladies can start watching for some of these signs and symptoms. Maybe you're sitting there saying, oh yeah, my husband, significant other, is experiencing a lot of weight gain lately, and he's really fatigued, and he's really depressed, and his libido has gone into the tank, and things just don't seem right. Pay attention. We have to look at this. Okay. So the thyroid, the HPT axis, hypothalamic pituitary thyroid axis. So we know that the thyroid is the master. That's why we start there. That's why we have to optimize the thyroid first, and then we start looking downstream. We look at everything else. So let's start over here with insulin, because we talked a little bit about the symptoms, the weight gain, the low energy, the low libido. Let's talk about its effect on insulin. So we know that when the thyroid is off, when you're subclinical, or when you have hypothyroidism and you're undiagnosed, you have Hashimoto's and you're undiagnosed, we do see an increased incidence of insulin resistance across the board, male, female, across the board, insulin resistance. So as that, here's how it ties into testosterone for you guys. As insulin goes up, we're in a fat storage mode, because having high insulin throughout the day is the fastest way to age, and it's the fastest way to put on weight. So being on that roller coaster of up and down, having your blood glucose on the roller coaster is a surefire way to put on weight. So we will see increased fat when there's insulin resistance or high insulin levels. Those fat stores, that's where your estrogen is. So estrogen is stored in body fat. So men, if you are carrying extra body fat, if you have a big belly, if you have breast tissue, you could probably wear a B or a C cup, that's a problem. That is not just you're eating too much, you're overweight. That is a big red flag, a huge sign for you that your estrogen levels might be elevated, because the estrogen is stored in fat. And when we start to see that estrogenic effect of male breast tissue, weight gain in the hips and thighs, a large belly. That's where we tie it back to, of course, we look at the thyroid, but then we want to look at insulin. We want to look at your estrogen and testosterone levels as well. So fat is stored in estrogen is stored in the fat. So you have increased estrogen levels, which then decrease testosterone levels. And this is a very simplified version. So I know many of you might know the intricate, scientific, biological, detailed version of this, but I'm trying to just simplify it to the bare bones so we can get to the point, right? So high estrogen equals low testosterone. Low testosterone equals increased fat. And then the cycle begins again. So then you have the fat, which is going to naturally kind of set you up for more insulin resistance, which is going to increase fat, which is going to store estrogen. Then estrogen is going to go up and testosterone is going to go down. Vicious cycle. Okay, so that's the insulin component as it relates to the thyroid. So that's why we test this first. We get the insulin under control. And we will be touching on different things that cause low T as well, like environmental factors in your diet. The diet is tied back to insulin because this can exist outside of anything being wrong with your thyroid. If we test your thyroid and your thyroid is optimal, fantastic, great. We still want to look at your insulin, so hemoglobin A1C, fasting insulin, and glucose. And then we also want to look at your estrogen and testosterone levels. So we're looking at you from a whole picture perspective. Then we come over here and we know that the thyroid affects all hormones. So this is where we have the HPG axis, the hypothalamus pituitary gonadal axis. So here we see testosterone, estrogen, and another name for low T, by the way, is hypogonadism. So if you've been told that you have hypogonadism, that means you have low T. Oftentimes, sometimes we see this even in young adults. So I have a 21-year-old patient right now who has low T. We're working on it. He's already lost, oh gosh, how much weight has he lost? He lost 30 pounds already. I think he's lost 30 pounds. Feels fantastic. Feels like he should for being 21. And ironically, his brother has it as well. So thank goodness they tested him. He was actually diagnosed low T, which means even below the lowest normal lab value, which we'll go over in a minute. That's in the lab range at the bottom. So hypogonadism is low testosterone, and that's where you'll see all of the different symptoms that we talked about as well. It all comes back to the thyroid being the master, but then we see the dysregulation of hormones and then the other effects, like I said, of environment and diet affect on the hormones too. So let's say you have low T, and we can see, again, low T symptoms really kind of reflect hypothyroid symptoms. So they're one and the same. That's why we have to check both, rule out one, or address both. Because if you have hypothyroidism and low testosterone, another double metabolic whammy. And oh my gosh, if you have insulin resistance too, you have to fix that, or you are just going to be fat and depressed and miserable with no libido the rest of your life. So that's kind of like the triple whammy, right? The triple whammy to how you look, feel, and perform: low T, messed up thyroid, and high insulin. And how much of that do we see in the population? I can't even say in America, in the general population, because I have patients in the UK and Australia too. So it's in the general population. Very, very important to test everything. Now let's talk about the range. Okay, you see this lab value range. That's like hitting the side of a barn, 250 to 1100. Now this can vary depending on the lab that you use. Some labs will start at 280. I've seen some labs start at 225. Some labs only go up to 1,000. Some labs will go up higher than 1,100. But let's just kind of generalize 250, okay? I wouldn't even want my dad to be at 250. That is way too low. And yet men are getting told that they are normal every day of the week, coming in at 251, 255. I've seen 265 being told that they're normal. And I joke that 250 is the testosterone level of an 80-year-old. But again, quite frankly, I wouldn't even want an 80-year-old to be that low. That's really, really low. And then again, like we said, with diseases, you are set up to have an increased risk of cardiovascular disease, obviously type 2 diabetes, and everything else that goes along with it. There's no quality of life there. And we have to look at quality and quantity of life. So quantity of life definitely plays a role. If you are at a greater risk of cardiovascular disease, obviously the the quantity, the lifespan is going to be shortened. But quality of life is very, very important as well. And we want you guys feeling good in the meantime and not just slugging through life, battling your weight, battling your mood, battling your low energy, not able to make it to the gym. So it's very, very important to have your testosterone and your estrogen levels tested. And why we test estrogen is exactly what we just went over. High estrogen can push down testosterone levels. So what causes high estrogen? And this is kind of the environmental and food factors coming into play. So we always hear of xenoestrogens. Those are in our environment. They're in the body lotion we use, the cologne that men are using. They're in plastic, if you are drinking out of a plastic water bottle, if you're microwaving your food in plastic Tupperware, anything with BPA in it, these are all xenoestrogens. And these xenoestrogens will artificially raise estrogen levels, but not in a good way. Men, you don't want high estrogen anyways. So genetically modified foods, a lot of soy products, and in addition to exposure to the xenoestrogens in plastics, BPAs, different foods, even the hormones that they use in your meat, in fish, farm-raised fish, non-grass-fed meat, those all contain hormones that can artificially raise your estrogen. So you can actually get a storage of estrogen just from exposure, environmental exposure, which will then drive down testosterone. We talked about the insulin connection. So if you are eating a lot of processed foods that can contain hormones as well, or be genetically modified, or contain a lot of soy protein isolate, soy flour, those foods can spike your insulin and then cause additional weight gain. When you're walking around with an additional 20, 50, 70 pounds on your body, you're going to have higher estrogen levels. That is going to drive down your testosterone. So your own choices, your food choices, your environmental choices are going to play a role in your testosterone levels too. So what do we do when someone presents with low T? So there's a couple different avenues that we can go. If someone is drastically low, if a patient is in the 250 or below, or really even, 250 to 400, 500, 600, we can use testosterone replacement therapy. And you've heard me talk about thyroid hormone replacement therapy. Same thing with testosterone replacement therapy, TRT. We use it because you are replacing hormones that are no longer there. Now, certainly we can do behavioral changes. We can pull out the xenoestrogens from your environment. We can change your diet. We can get you to lose fat. But in losing body fat, there are oftentimes dumps of estrogen, which then push down your testosterone. So it's very good to support the system and do so through testosterone replacement therapy. That gives the fastest result. Now, that has to be prescribed by a doctor. And in town locally, I recommend Regenesis HRT Erie. They are fantastic doctors, fantastic. And they really work with my male patients to get them to optimal and not just normal. It's not just about getting you over that 250 hump. It really is about getting you up into the range that is right for you. So with testosterone, there's no, we'll say, pinpoint range. It's really age dependent. But I will say this now. I said in another video being released this week too, when we talk specifically about the ranges, I really don't want to see anyone under 500, maybe a number 600. 500 is acceptable. 600 is better. I don't care what age you are. I want you above that. So if you're coming to me and you have all those symptoms and you are 400 and your doctor told you that you're normal, you're not normal. We have to rule out thyroid, but we have to look at your testosterone and estrogen levels. Now, I'm not a huge fan of aromatase inhibitors. They can be used if a male is pushing testosterone into estrogen. So testosterone can aromatase into estrogen. And a lot of times we use AI to block that estrogen, very similar to what we use for breast cancer patients, tamoxifen, Arimidex. And those can be used sporadically, sometimes short term, just to block that big dump of estrogen, especially if we're changing up your diet and we're getting you to lose fat as well. But I think dietary changes, as well as the use of DIM, Indo-3 carbinol. That works really well for an estrogen blocker, aromatase inhibitor when doing testosterone replacement therapy. Now, the other option is a product called LibidoStim-M from Designs for Health. I can post the link to that for you guys. It really, really works. So I kind of wish Designs for Health would change the name. So Designs for Health people, if you're listening, it's not just a libido product. And I think the name kind of steers people wrong and they go, well, I don't have a problem with libido. No, but you're gaining weight and your energy's low and you're depressed and you're dragging yourself through the day and you have man boobs. So we have to do something about that. It's not just about treating libido. And LibidoStim-M absolutely works to naturally raise a man's testosterone level. So if someone comes to me and says, I absolutely do not want to do the androgel, the injections work better than androgel, just by the way. I don't want to do any kind of TRT. I want to do this naturally. Then we're going to get down and dirty with your diet. We're going to change that up and we are going to use LibidoStim-M. And we will see your number raise. So as we get those labs done, get your blood work done, we will see that number go up. Hands down, no question, across the board. Okay. So LibidoStim-M and then TRT, testosterone replacement therapy, can be used. That has to be done through a professional. LibidoStim-M, you can get on your own and try that naturally. But know your number. Know your testosterone number because it plays a huge role in overall health and how you feel and how you look, feel, and perform. And ladies, I think it's important for you to push your men. I mean, some men, listen, they know that they feel like garbage. I've had 30 and 40-year-olds with low T. I've had 50 and 60-year-olds with low T. It is across the board. It's not age dependent. Yes, testosterone levels start to drop after the age of 20, but you shouldn't be 30, 35, 40 and feel like you're 80. That's not right. So that's where you really want to know your testosterone number. And by the way, Ulta Labs too. Let me post I know this month it's like $12. And if your insurance for some reason doesn't cover it and you get $100 bill, no, just go to Ulta, order it yourself. You order it a la carte. You put it in your cart. You go to checkout. You pick the place that you normally go to get your labs done after you put in your zip code. And you print the requisition form, take it in, they test it for you. Super easy. Pretty much anybody can do it except New York and I think Rhode Island, a couple other states too. And the majority of my viewers are women, but women, this is important for you to know because I guarantee you, your man is not going to go on his own. He's going to get worse and worse and worse before he finally hits the point to say, okay, I'm not feeling myself. And you want him to be happy. You want him to feel like a man, right? And not be tired and depressed. That's not good for anybody. And it's not good for his own health, his heart, his overall condition. We don't want type 2 diabetes in the lineup. So you ladies take control, get your man tested. Thank you so much for listening to the Thyroid Fix podcast. As always, please share this with anyone that you know that needs this information. And I guarantee you there's a lot of people out there and in your life who do. Also, please remember that anything that you hear on this podcast is not intended to diagnose or treat. So you always want to check with your doctor about any advice given that you hear on this podcast. And if you would like to book a discovery call, a free discovery call, to go over everything that's going on with you and to go over how I can help you, please go to my website at amiehornaman.com. The link is always in the show notes. And click on book a call. Choose a time and a day that's right for you. And we will see how we can help you. Thanks for listening.